If you're over 50, it's likely that you've started to experience some aches, pains, and stiffness. Well, what if I told you that something as simple as shining light on the problem could help? I know it sounds weird, and I didn't want to believe it myself at first. But after 9 months of trying various different red light and infrared light therapy products and diving into the research, it's undeniable that there's something to it. In this video, I'll explain the effects of red light therapy and infrared light therapy specifically for people over 50 and show you how using a red light and infrared light therapy sleeping bag like this one can be helpful if you have multiple different areas of pain. Let's dive in. So first of all, what are red light and near infrared light therapy? They're forms of photobiomodulation, which basically means different wavelengths of light can have different effects on living tissue. Red light is in the visible spectrum, going up to about 750 nanometers. Near infrared light is just beyond that, from 750 nanometers wavelength to 1400 nanometers wavelength. And then beyond that is mid-infrared and far infrared. Now, if we turn this mat on here, you'll see every other row of light appears to be lit up. And they're actually all lit up, but the ones you can see are red light. The ones that appear to be off are near infrared light. It's outside the visible spectrum. Now, specifically, the red lights are 660 nanometers, and the near infrared lights are 850 nanometers. We'll get into a little bit more about why that's important later on. Next, though, what conditions are red light and infrared light therapy good for? There's been a ton of research over the past several decades, and so I couldn't possibly cover everything. But some of the common ones to people over 50 are arthritis, tendinitis and tendinopathy, low back pain, chronic pain conditions like fibromyalgia, neuropathy. It's been shown to be helpful for muscle recovery after workouts. It's also been shown to help with sleep quality. So there are lots of different things that you can use red light therapy for. It's also good for skin conditions. And that brings us back to wavelengths. What wavelengths of light are most effective? In general, the longer the wavelength of the light is, the deeper the tissue penetration. So red light therapy is helpful for skin conditions or wound healing, whereas near infrared light therapy has a longer wavelength and is better for deeper tissues like joints and muscles. Now, what about moving beyond 1400 nanometers into mid and far infrared light therapy? Well, there are a lot of effects of far infrared light therapy as well, but far infrared light is more absorbed by water molecules, and basically it makes your water molecules vibrate faster and causes heat. So the main effect of far infrared light therapy is for heat. But for tissue healing, near infrared light therapy is the best for deeper conditions like joint and muscle problems. Now, how does it work? Well, the most commonly cited mechanism of red light and near infrared light therapy is increased metabolism by activating your mitochondria. Red light and near infrared light activate an enzyme inside your mitochondria known as cytochrome C oxidase. That's part of the process that turns your food, glucose, into energy. And so red light therapy and near infrared light therapy activate that cytochrome C oxidase and help you produce energy more efficiently. Now, this is where we get back to wavelength again. 660 nanometers of red light and 850 nanometers of near infrared light have been the wavelengths shown in research to activate cytochrome C oxidase to the greatest extent. So that's why this product and many other red light and near infrared light therapy products use those two specific wavelengths. Additionally, red light therapy and near infrared light therapy cause the release of nitric oxide, which is a vasodilator, meaning it makes your blood vessels dilate. That increases blood flow and oxygen to your tissues, which also helps out with healing. Near infrared light therapy has also been shown to decrease pro-inflammatory mediators and increase anti-inflammatory mediators, which has a net anti-inflammatory effect. And then finally, near-infrared light therapy can activate your opioid receptors, so it acts as a natural pain reliever. Now, what about dosage? How much red light and near-infrared light do you actually need to be effective? Well, the dosage varies by condition, but if we're talking about joints and muscle problems, we're looking more at near-infrared light dosages, which should be 6 to 12 joules per centimeter squared. Now, a joule is a unit of energy, and a joule per second is a watt. And so you take the number of watts times the time, and that's how you find your total dosage. Now, the power settings on this device and other red light therapy devices are measured in milliwatts, which is 1,000th of a watt. Now, this one has 5 different power settings. So for the red lights, the power settings are 50, 100, 150, 200, and 250 milliwatts per centimeter squared. For the near-infrared light, the power settings are 30, 60, 90, 120, and 150 milliwatts per centimeter squared. Now, keep in mind that those are the power settings at the skin, and radiant energy declines rapidly with length away from the light source. That's why being right up against a red light therapy device like this is much better than sitting, say, a foot or so away from a red light therapy panel. In fact, there's a law called the inverse square law that means for every distance you move away, the power decreases by the square of that number. So if you move twice the distance away, the power decreases by a factor of 4. If you move 10 times the distance away, the power decreases by a factor of 100. So when you actually calculate the dose that's getting down to your tissues, you have to take that into account. Now, for deeper tissues, it's estimated that only about 10% of the energy at the skin actually reaches deeper tissues 2 centimeters down. So keeping that in mind, I had ChatGPT do the math for me. And as you can see, with the lower power settings, you need around an hour to reach that 10 to 12 joule per centimeter squared dose. Whereas with a higher power setting, you only need around 11 to 13 minutes to reach that same dose. So why not just use the highest power setting? Well, that is okay if you're not sensitive to red light. And so when you're first starting out with this device or any device, it's recommended that you do a sensitivity test, setting it on the lowest power setting for 10 minutes and then seeing how your skin responds. If you don't have any problems with it, then you can gradually increase the power settings to your desired dosage. So now let's take a look at how it actually works. This is the QuasarMD red light therapy sleeping bag. And as you can see, it has red lights and infrared lights on both the top and the bottom of the device. Each side is controlled by a different power controller. So we'll switch one side on, this controls this side, and then switch the other side on. It has different pulse modes. So if we hit that again, you can see it flashes at 10 hertz. That's 10 times per second. This is 40 hertz. So you probably can't perceive this, but it's actually pulsing 40 times per second. Video only captures at 30 frames per second, so you're probably not actually perceiving that over the video. And then if we move to this is the H brightness gradient mode. You can switch between modes just by pressing this button here. You can also switch between power settings, going to the different power modes that I mentioned before. You can switch the wavelength. So this is red light, 660 nanometers only. This is infrared light, 850 nanometers only. And this is both, or all of them. You can change the time settings from anywhere from 10 to 60 minutes. If you remember that chart I showed, you can choose your time according to the dosage that you need. Now, what about safety? If we're talking about radiant energy, you may wonder if it's actually safe. And as I mentioned before, red light therapy has been highly studied and it is in general very safe. This particular device has also received FDA clearance. Now, what about my personal experience? As I mentioned, I've tried a number of different red light and infrared light, even far infrared light therapy products over the past 9 months or so. And in general, I do like near-infrared light therapy devices the best. Far infrared feels good, but it's more just a deep heat. Near infrared I've found helpful for sore muscles, stiff joints, particularly my shoulders, or just recovering from workouts a little bit faster. I do have some wearable devices, which are very nice to be able to go around, just strap one on my shoulder and go on with my day. But if you've got various different problems or multiple areas of your body that are bothering you, it's helpful to have something where you can treat them all at one time. And if you just lay down for 10 or 20 minutes, if you're at a higher dosage, you can treat your entire body at one time. In fact, this device has 2052 red light and infrared light LEDs. So you're getting a high coverage of your entire body. If you'd like to check out this Quasar red light and infrared light therapy sleeping bag, check out the link in the description below. And if you found this video helpful, make sure to give it a like. And if you haven't already, subscribe to the channel so you get notified of my future tips. Thanks for watching, and I'll see you in the next one.